So there's something that I feel like is a bit of an open secret within the field of medicine, and that's actually around the idea of informed consent. Now, let me start off by saying that the idea that doctors are educators is something that is a pretty universally recognized within the medical community. Doctors during training are always taught that doctors are educators. You educate patients. You're the one that's responsible for the compliance of a patient for a particular lifestyle intervention or medication. If there's a diabetic, you need to educate them about diabetes in order for them to actually take their insulin, and they find that relevant. And so education ends up being one of the most important roles of a doctor, and actually arguably one of the most meaningful and impactful roles that a doctor can actually have. But interestingly enough, doctors aren't really taught on how to educate. And I can say that with the utmost confidence that doctors are taught how to educate inadequately, because of the fact that I've had training on education, and I work now primarily within the education sector, and it's what I am, neck deep in, is education and how to teach effectively. And I mean, to be totally frank, there's no other way of saying it. Doctors are, unless you're lucky to get a doctor that just is a better communicator and better at educating, in general, from a system level point of view, doctors and education and the training around that and the enablement of doctors as educators is done extremely poorly, to really like an embarrassing level. And I think that's why a lot of people will go to their doctors and then they'll just feel like they weren't listened to, or they feel like they're still confused. And I can't even count the number of times that I've been in a consult room, as a student even, where I'm listening to my senior explain something and I'm just thinking, my God, that's a terrible explanation. This patient is clearly confused. It's written on their face. And either they don't pick up on that, or most likely they've kind of given up, or they don't know how to communicate that in a different way. And I think sometimes it even becomes externalized in that it's like, okay, well, it's this patient's fault for not really understanding and then finding it that it's relevant. But obviously that's not the case. It's the role of the doctor, and it's the responsibility to actually infer that relevance to the patient. And so as a result, bringing back to the topic of informed consent, it's fundamentally flawed. So when you look at all the medical ethics that are out there, there's those 4 key medical ethics that every doctor knows about, right? It's beneficence, do good; non-maleficence, do no harm; autonomy, in that the patient has the right to their own health decision-making and behaviors and their choices; and then justice, which is more of a system-level fairness and equity. So when you think about medical ethics, arguably autonomy sits at the pinnacle, is the idea that we never know enough about our patients in order to make a decision paternalistically based on what we deem is going to be better for them, because we never know their reality as well as they know it. We don't know what their priorities are and things like that. So because of that, it's impossible for us to make the decision for the patient. But here's the thing, the theory is fine, but then that means that the patient is the one that needs to make the decision. In order for the patient to be the one that makes their own decision, they need to have a robust enough understanding about the topic for that decision to be aligned in their best interests. So for example, let's say that you've got you need to get your gallbladder removed, and so you're being consented for a surgery, but you don't know anything about the surgery. You don't know what it's for. You don't know why you need it. You don't know the consequences of what happens if you don't get it, but you don't like the idea of surgery. Then this person has some complication, or even develops an infection and dies. That's, I'm sure, was not in the best interest for this particular patient. If they knew as much about that surgery, would want to do it. Not all the time, obviously, there are exceptions to this, but generally speaking, the more you know about something, the better your decision-making capacity is for that particular decision. And so If doctors are not good at educating patients, then the amount that they know, which is really largely dictated about what they're told, is the main influence on how they make that decision. So their decision is not going to be aligned in what their best interest actually could be. Now, the other thing is that the health system doesn't actually allow for this. And that's the important part, is that it's not that doctors just don't care. I think some doctors don't, but most of the time, most doctors really do care. And most doctors believe patient education is of paramount importance. But the system really doesn't allow for that. I mean, if you're on a busy ward round, a ward round being when you're kind of going around and seeing all of your patients, and you've got 60 patients to see, and you're spending like 15 seconds per patient, and in the 30 seconds between you seeing this patient and the next couple patients later, you need to book and consent this patient for a surgery, well, you're not really going to have time to explain the procedure and the diagnosis or anything to this patient in any level of depth. And then you could say, well, why don't you just spend more time? Well, time is a resource, and time is a resource that is under heavy constraint in the health system. So the system itself is not designed to allow doctors to actually spend time to communicate and educate patients in the way that they need to, let alone doctors generally being very vastly undertrained in effective strategies at communicating and specifically teaching for patients, which is a different technique from just communication. Doctors in general are, generally speaking, are quite good communicators. Educating is a sort of a step beyond that. It's a different sort of skill set. So combine that fact with the fact that the system doesn't allow it, and then you're left with patients that generally don't know what they're consenting for. They don't know what the decisions they're making are about. And so they're making decisions that we assume is in their best interest, but actually they just end up making the decision based on what information we give them, which also means that if we have a particular bias and we think that this patient, based on what we know about this patient, which could be a lot, could be a little, we think something's going to be good for them, we can pitch that information in a way that makes it seem like this decision is definitely the best one. And now there are situations where that could be appropriate, because to have the level of understanding about this particular procedure or whatever they're getting compared to the risk or the perceived risk or the benefit, to have that level of understanding, it could take, that patient hours or even months or years of study and learning and experience to really have enough understanding about the situation to make a decision that is truly aligned with their values and their priorities. And so the concept that we are doing these in the best interest of the patient is good and necessary, but the reality, the execution of it is undermined completely. So despite autonomy being an informed consent, being one of the most important principles of medicine that underpins the trust and the integrity of clinical medical practice, it is largely, I think, more of an illusion because of the fact that educating is not really done to an effective level. Now, I've had this same conversation with a couple different consultants, a lot of different registrars, and a lot of of my own peers, and there does seem to be a general consensus that agrees on this. But if you are a patient, or if you're a doctor, or if you're a nurse, and you have a different view on this, and you think that what I'm talking about doesn't really quite make sense, well, you've got another point that I haven't thought of before, then please do leave a comment, because I would love to continue this type of discussion more. I think that I think we all know the system is reasonably broken, but a topic as important as this, autonomy and this aspect of medical ethics, I think is, these are important discussions actually to have. And I've weirdly not heard many people having this particular discussion about this particular issue, which makes me think maybe I'm missing a point. Or maybe it's just something that people don't really like to talk about. Either way, I'd love to hear what your thoughts are.